Hi everyone, this is Dr. Siddhan Jain, an international medical graduate from India, and this is a video brought to you by USMLE Sarthi, where we are going to discuss about how things have changed in USMLE in the recent years, and how should we go about it now, how should we strategize in the coming years so that we all have a successful match. Some of the major changes that happened in the previous years is that the USMLE Step 1 got pass and fail, CS was replaced by OAT, and then COVID came, and then now COVID is over, so the time of telerotations came, and now we are again back to on-site rotation. So these were the major changes, and now we are going to dissect each changes and talk about how it impacted and how should we strategize for the coming match. So with step 1 going pass and fail, the whole way of approaching the exam has changed. Now step 1 is an exam where you should concentrate on making sure that you understand first aid, the concepts really well. As soon as you are able to reach to a position where you understand the concepts, are able to solve most questions, and you feel like you have a deep understanding of the whole syllabus of step 1, you should go ahead and take the exam. Earlier, everybody used to make sure that they perform really well on mock test, and they avoid silly mistakes and the finer details. But now you have that liberty that once you feel like you are prepared with the concepts, you can go ahead and take the exam. So make sure that you study well for step 1, but also make sure that you are wise about your whole USMLE timeline, because this is the point where you can cut some months and then use it for CK or other stuff which will become important after step 1 goes pass and fail. So now let's talk about the implications of step 1 going pass and fail, and we'll dissect this into two major categories. First is step 2 CK, and then the other stuff. So obviously with this going pass and fail, the numerical value in step 2 CK becomes the single most important distinguishing factor, especially for international medical graduates. You should make sure that you take really good you take a really good amount of time and efforts to make sure that you do perform well in this exam, because this is going to be your only chance to shine. This, along with step 3, also becomes important because now everybody wants to have a complete application. The competition is intense. So people are also making sure, even the recent graduates are making sure that they have step 3 in their profile before application. So completing step 3, preferably getting a good score, and obviously a really good score in step 2 CK. These things become very important once step 1 goes past. A very good strategy, according to me, for all three USMLE step exams, and for somebody who's starting just new, is when you look at step 1, you think about foundation, make sure that the concepts are good. Give that exam, take 5 to 6 months at maximum, give that exam, take that exam, and intensely start preparing for your step 2. So when you are done with step 1 and you look towards step 2 and step 3, see them as 2 exams together, because the content in step 3 is very much similar to step 2. So when you start preparing for step 2, may understand that everything that you do for step 2 will be used in step 3. So you make sure that you perform well on UWSs and mocks before taking step 2, and you make sure that you keep limited time between step 2 and step 3, because that will save you a lot of time and you don't have to revise a lot of stuff again while you take step 3. So I think this is a really good strategy to approach all the USMLE exams now. Okay, so now let's talk about other stuff. Other stuff means research, volunteering, your med school status, your scores in your med school. So all these things. So understand that the purpose of all these things is categorized into two. Firstly, you do all these things to make sure that you have enough to talk about in interviews. because interviews is not about your scores or how good you are academically. It's about how well you are able to present yourself, and how are you able to talk about the stuff that you did, and that is in your CV and profile. So so make sure that you do all this with all honesty, so that you are able to talk about it, and when you talk about it, it shows that you have really worked on these things. So this is number one. The second thing, that it helps you to build contacts. Since step one has gone pass fail, program directors do not have a lot of uh, things to judge you on. So it has become really important to make contacts. Also, they receive 6,000 applications. It's very difficult for them to screen them. This year, a lot of program directors had this view that it was very difficult for them, because there were so many highly qualified applicants. It was very difficult for them to screen and invite for the interview. So it really becomes, making contacts really becomes important here. You will never know who will help you during the match. Some random person who you had research with, some attending, anybody. So volunteering, research, all these things you should be doing for two things. First, being able to talk about it, and second is to build contacts in the US. So talking about research, when you're in med school or in Indian med schools, there's ICMR projects that people do. That becomes important. Any sort of research experience, even some projects in preventive and social medicine, all these things becomes important. And a lot of students who prepare for USMLE now enroll for official research courses. For example, USMLE provides different sort of research courses where they help you club with different physicians, and all of you guys together do a research which is guided by a supervisor. So this is how you can add research experience to your CV, and get some publications. And if some program directors interviews you, he'll be like, this is something interesting, tell me more about it. And that is your opportunity to shine and talk about it. Even for volunteering, try to do online volunteering. Remote volunteering is sometimes, which is these days an option today. And you can, whenever you get like 3 to 4 weeks, try to find some volunteering options around your area. Especially if you are doing rotation in the US, try to do some volunteering in US, and somewhere around the hospital or near the area. For example, I did a volunteering in Houston food bank. So that is something you could consider. Let's talk about the transition from telerotation to on-site rotations. So now, since we are out of COVID, doing on-site rotations is really valuable. During my interviews, I've had people say that they really value on-site rotations more than telerotations, and they really value people with rigorous clinical experience. So make sure that you do combination of clinical experiences, like inpatient, if outpatient. If you get an elective, that's really good. If you don't get an elective, try to do some externship. USMLE Sarthi has a lot of rotations, you can check that out. So clinical experiences is really important, especially on site, because in almost all my interviews, and based on what I discuss with my friends, they were asked a lot of questions about their clinical experiences. So make sure that you perform really well on clinical experiences. Honestly approach them, try to learn, so that when you give interviews, it reflects that you have worked really hard on the clinical rotations and you are aware with the US medical system in general. So as I mentioned before, step 3 also becomes really important, especially for people with red flags like old year of graduation, low step scores, or gaps in their CV. It's a really good way of showing the programs that you are clinically in touch with the entire syllabus, and you are ready for the residency. So that is something that you should absolutely consider if you have all these red flags. Finally, since I have interviewed this year, and early this year, step 1 got pass and fail, and all the changes were implemented. My experience says that a good match season is when you have a good profile or CV, research, volunteering, clinical experiences, good scores in STEP exams. This in combination with good contacts in the US. Both have equal important roles, like 50% is 50% is. So make sure that you approach USMLE with this mindset that not only do you have to be good academically, but you really have to be a person who has contacts or who are friends with people who can help you get into a program. I think we have covered all the important topics today, and I wish you all the best for the upcoming match, and Happy New Year.